250 Australians evacuated from the coronavirus epicentre of Wuhan are on their way home after 2 weeks in quarantine in Darwin. Their departure comes as health authorities confirmed 7 Australians evacuated from the Diamond Princess cruise ship last week have now tested positive to coronavirus. So joining me live now is Professor Len Notaras, Executive Director of the National Critical Care and Trauma Response. Len, good morning to you. Thanks for your time this morning.
Good morning,
so how would you sum up success so far in containing the virus, even though there's been a sharp uplift in the number of people on board that cruise ship?
Oh, Pete, I see it as a success. To this particular point, given the success of Christmas Island and the folk who left Christmas Island almost 280 about a week ago, and that was fantastic without incident. On Saturday we saw a number of folk, 266, leave the Howard Springs village, and now we've got 153 from the Diamond Princess remaining. 7 have actually gone back to their states of origin because they have tested positive to the coronavirus. But the operation thus far, dealing with more than 700 people, has been a very successful one, and a tribute to Australia's medical assistance team training around the country. The point behind it, I guess, is that we can't lower our level of vigilance at this stage. We should remain alert. We should not be alarmed, but we shouldn't reduce our level of vigilance. Very simple methods to observe, like hand washing and all of that sort of stuff as well.
Len, there are reports that many of those on board the Diamond Princess showed no symptoms at the time that they tested positive. So at what point are you only running coronavirus tests on evacuees with symptoms?
Well, we test all of the travellers who are at the village. We're testing them daily. And the symptoms mimic, in a sense, those very similar to the common cold or the regular flu that we see on an annual basis. So people may present with a runny nose, with some sniffles, sneezes, whatever else, sore throat and so on, and a low-grade temperature even. So we've got to treat until proven otherwise the travellers from the Diamond Princess as suspicious until shown otherwise. Now, we do that through history and examination, but we also do that through diagnostic testing. And I've got to say, over the last 2 days, there has been a favourable plateauing in the positive. So in other words, in the negative, I should say. In other words, we've not had people coming back positive to the virus over the last 24, 48 hours.
Are people staying in quarantine facility who have been in contact with infected patients having their quarantine period reset?
No. What we are doing, if the whole protocol on site is designed in such a way that we separate people in such a way that they don't contaminate others who are not, who are clear of the virus anyway. Now, if somebody was proven to be positive, they would be treated appropriately, and we would repatriate them to a state from which they came. In other words, we're not placing a burden on the health system of the Northern Territory. What we are doing is using resources from right around the country, and that's what makes this whole AUSMAT operation a fantastic triumph for health in the country.
Okay, Len Notaras, so appreciate your time. Nice and early this morning in Darwin, but thanks for coming on the show.
My pleasure. Thank you.